Hi, my name is Matthew Terry, and this is my senior seminar KHS 491 presentation. I've done my senior seminar presentation on occupational therapy, which is the field that I hopefully am going into. Occupational therapy is the practice that is involved with the treatment of neuro disorders, um, and rehabilitation. Say if you are in a car wreck or lose the mobility in your hand, then occupational therapy will help get those gross and fine motor skills back. And it also can help with pediatrics, it can help daily routines. And in my research paper, I included a lot of the specialties that an occupational therapist can be. Occupational therapy started around the 1800s, when there were physical therapy patients, or there was a psych ward that people would be thrown into, and if they had mental disorders, and no other doctors or physical therapists had treatments for these patients, and they wrote them off uh, until someone came along and suggested trying to work with them to promote them to some sort of occupational treatment so they could be useful work, whether it was for his own benefit, the country's. It ended up working, and it used a lot of holistic practices. So it gathered from psychology, it gathered from physical therapy. It didn't use any medicine, just physical practices. And I can understand that from what I have been learning throughout my 4 years at LSUS with the many psychology courses, as well as biology and the kinesiology courses. In the 1900s, during the war, occupational therapists served, and this is when it really started picking up steam, because we needed people that were serving in the military, or whether or not they wanted to be there, to do something. And so they started working with these injured people to do, I believe it was called ADL jobs. And this promoted them to begin working again, which also contributed to their mental health. And so this ended up working. Other people took note. And so occupational therapy became more of a big thing. Today, occupational therapy is the fastest growing medical practice in the world currently. And it is still evolving rapidly. Even at LSU Health, they have changed it from just a master's program to a doctorate program, making it the only doctorate OT program in Louisiana. Even the one in New Orleans is just a master's program. Occupational therapists have to be passionate, creative. They have to be willing to always learn because of how rapid occupational therapy is always growing. And so all of those qualities also need to rub off on the patient. A patient might come in because of a neuro injury that they suffered while drunk driving. Now they have lost their legs and now they have to adapt to life. Most people wouldn't care to try to obtain a normal life because they don't think it's possible at that point. You just lost half of your body, basically. And so, occupational therapy, you have to work with that person to create different routes in their life that they have to adjust to in the most efficient manner possible. Also, a baby might be born with a neurological disorder and doesn't have the correct ability that they need to in their hands. And so occupational therapists will work with the kid to point out any deficiencies that the child might have and also work with those fine motor skills. Occupational therapy works closely with physical therapy, but they are different, as occupational therapy is more of a holistic practice, and physical therapy is pretty much a straightforward fix the anatomy side of things. That's a basis of my report for senior seminar on occupational therapy, and have a good day.